Public satisfaction with the NHS has apparently hit the lowest level on record, according to the new British Social Attitudes study.
A study of more than 3,000 people in England, Wales and Scotland found that fewer than 1 in 4 people were satisfied with the health service in 2023.
Which is 5% lower than the previous year. Now, only 34% of people said they were actually satisfied with GP services in 2023, with 71% saying that waiting times for GP and hospital appointments was the main reason for their dissatisfaction with the NHS.
What we can see from the answers that people are given is that people are really challenged around those long waiting lists. We know there are millions of people on waiting lists. We know there are challenges around access to primary care, and that's linked to those waiting lists with people being on there for long periods of time. We also know that the NHS is also reliant on a very functional social care system, and the public are clear that that's not what they're getting right now. Actually, although the NHS satisfaction was 24%, it was even lower for social care at only 13%. So I suppose the findings are very bleak, but shouldn't be surprising after a year of long waits for care, strikes and scandals hitting the NHS.
We're joined now by Rory Dayton, who is the director of the Acute Network at the NHS Confederation. Morning to you. These figures are really quite grim reading, aren't they?
Morning, Sally, and yes, they are. I think they reflect exactly how people are feeling about the NHS at the moment. I think times are tough. I think it's hard for staff, and I think that people recognise that. I think that we've had just a really, really hard year in the NHS, and that's coming through in some of these figures and how people are feeling.
And one of the main problems that the figures show is that it's actually access, isn't it? It's waiting times, waiting for a GP appointment, waiting for a hospital appointment. What needs to be done in order for people to get their appointments quicker and feel like they're going to be seen when they need to be?
Sally, I think you're absolutely right. And I think the focus for NHS leaders over the next 12, 24 months or so is very much on that access issue. It's about getting the basics right of GP access, of dental access, of the waiting list, the 7.5 million people who are on elective waiting list, and longer waits for community services as well. So that's the absolute focus. I think on the other side of it, that some of the solutions that the NHS needs to see are perhaps outside of its control. So an end to the industrial action. There's a really strong link between the industrial action that's been going on for 12 months now and the size of those elective waiting lists. I think those waiting lists would have come down by now had we not seen the extended industrial action. I think capital investment is absolutely required. Investment in social care. Those are the sorts of things that we'll really need to start to turn these figures around in the future.
But there is a real sense, isn't there, from people who use the NHS, when they get to use the NHS, even if they've waited a long time, that the service they receive, they are incredibly grateful for. This is not about staff, is it?
Absolutely not. Standards for people's experience of emergency services, of elective care, remain much higher. This is all about perception. This is about people's confidence and their anxiety, I think, in where the NHS is at the moment. I think the survey shows really strong support for the principle of a publicly funded NHS funded through taxation. I think 48% of people responding to the survey would favour an increase in taxation and 42% maintaining funding at the same sort of level. So it's really strong support for the principle of the NHS, really strong support for the people working in the NHS, but it's that constant drumbeat that we've seen this last 12 months of industrial action, dental access, GP access, long waiting lists. That's what's driving how people are feeling about the NHS at the moment.
You mentioned confidence. How do you maintain confidence or build confidence for members of the public when they can't get to see a doctor when they need to?
I think that's why the focus for many of the leaders that we represent is on that short term. It's about improving GP access and dental access. And I think there's a real recognition that although some of the solutions, the long-term solutions to where the NHS finds itself are long-term capital investment in estates and hospitals and GP premises, social care really needs investment. So that's where the real solutions are, but there's an enormous focus within the NHS at the moment on driving down waiting lists. There are more GP appointments being delivered now than there ever have been before. So a real short-term focus, but a long-term view at the same time.
Rory Dayton, Director of the Acute Network, thank you very much indeed.